So this is the youth team production board that was developed out of RPIW number 45. The production board was developed out of a need for the team was not meeting the provincial benchmarks set by the province. So clients who come to child and youth need to be seen in a certain amount of time. So very severe needed to be seen within 24 hours, severe needed to be seen within 5 working days, moderate needed to be seen within 20 working days, and mild needed to be seen within 30 working days. And historically, last February, we were not meeting those targets on our team, and we were booking our clients 3 months in advance. We were also booking in a way that meant it was first come, first serve. So clients weren't, they were triaged, but they weren't given a priority appointment based on that triage. And so the RPIW, the goal was to make sure that we were seeing all the clients within the provincial benchmark times. And one of the ways that they thought about doing it was making sure that all clients weren't receiving the same service. So mild clients didn't necessarily need the same intensity as a very severe client, and vice versa. So the team developed the production board, which was a way for us to book our clients, save some spots, and then make it much more responsive to the needs of the clients. So I'll just explain the board a little bit. It's 6 weeks worth of new clients that come to each of the youth team clinicians, and they're all listed here. We have our youth mental health team and our youth addiction team. When you see there's lots of little icons on the board that were developed by the team, and the team put a lot of effort into making this fun. It's a child and youth serving agency, and they wanted it to reflect that. So you can see that the X's on the board indicate that a staff member is unavailable, away on vacation, or not in the office. The minions, these little minion guys, indicate that someone's away from the office sick. And so that indicates to us sometimes that we might need to do something different, cover one of their clients, see if any of their clients need to be seen. The school buses right here indicate that our outreach team are away out in a school during the day. So when those are there, they're also unavailable. Now, the biggest changes, youth team clinicians used to get 2 new intakes a week that were booked by intake. Now they get 2 a week still. Here you can see they have a red and a green, and the red ones are always booked by the intake team. So that means those are moderate clients, and those ones are always booked without any discussion. The green spots, however, are left open, and we leave these open for severe clients, for mild clients who actually need sort of a step up in the level of service, or for a re-registration when a client comes back after a year and they need to be seen. We have also increased our capacity by adding these purple consult spots. So these are for mild clients, and there's 4 spots every week on Wednesdays, and it rotates through the team. So the team will be the consult person 1 week, and then the on-call, and then they have a 4-week break, but they don't have to do that again. During the week that they're the consult, they also don't get a green spot. So the consult spots are about providing mild clients with a very low intensity service. They may get referred to a group, they may just get some information, and they may not show up. So those spots aren't taking up a whole intake spot as they would have in the past.
So we meet every morning as a team at 8:45 for about 5 minutes, and we call it our morning huddle. And that's where we kind of get a live view of who is here, if anybody is away sick and we need coverage, or maybe that's when we discover that there's been a severe and we need to use one of those green spots.
So I'll give an example of if the intake team brought a severe to us. We would look to the calendar day today, and we'd find out a severe needs to be seen within 5 working days. So say it came on this day, we would count to 5, 1, 2, 3, 4, 5, and we'd look for a green spot on the wall. And so we'd give it to the next available green spot there, so that those clients can be seen in a really timely way, and we're not having to ask favors of the team whenever we have one of those. Since incorporating the daily production board, we have met all of our provincial targets, so we're meeting 100% of our very severe, our severe, our moderates, and our milds, which is a huge success for this team that historically has always had a considerably long wait list. So.